Yo, what's good, everybody? It's your boy Jamal_Hockey. And today, we are here for an interesting video for you guys. Listen, man, I feel excited to make this particular video. I've never made anything like this before, and I think you guys are going to love this. Now, reason why I think this video is important, let's start off with that. Now, on my journey of trying to study and find helpful hints and tips and stuff to help me out, I'm gonna be honest, I really didn't find too informative things that really helped me, but it was some things I found that kind of helped guide me in the direction. Barely. So reason why I think this video is very important and very much needed is because it's not that many videos out there. Number two, it's from me. That's why it's important as well. Oh! So, as you can see in the title of the video, it is how to get a level 3 in nursing care of children. So if anyone's currently in a registered BSN program, accelerated program, RN program, you name it, whatever course that you're in where you have to take pediatrics, right? And one of the requirements may be you have to take the HESI depending on what state you're in, or you have to take the ATI. For this, if you got ATI, you came to the right place, because I'm gonna get you right. I'm gonna help you achieve a level 3. Now, I'm no simpleton, but I'm not saying I'm the smartest person in the world. So if you understand everything I'm saying today, then you good.
Oh, is that so?
Let's start off with the first things first. There's only 2 major things you really need to achieve a level 3. And I'm gonna show you the results, I'm gonna show you the proof, and I'm gonna show you my notes. And if you need anything, just hit me up, hit my email down below. All that's gonna be in the description. So there's only 2 major things you need. For one, you're going to need, read the ATI book, right? I would grab my ATI book, but listen, I'm just gonna use this. I don't feel like going to go get it. This ain't the dang ATI book, but read it. Now, let me throw in a caveat real quick. You don't have to read every single page, because I'm gonna be honest, I sure didn't. So let's actually focus in on what you need to do in terms of really having effective reading. What I did was, I did 3 major things. I got my notes right here. I focused on reading things that I didn't understand too well, meaning that if I had a vague sense of understanding, I needed to read it more. For instance, if I needed to know a little bit more about nephrotic syndrome, and then especially knowing the difference between nephrotic syndrome and glomerulonephritis.
What?
You already know I was rereading that thing because I can't even say the word. So if I need to know the difference between the two in terms of its expected findings and the main manifestations of it, symptoms, signs and symptoms of the two, what's separate, I wanted to read more about it. So that would be a major thing of why I would read the ATI book. Again, I'm not reading every single page, because if I already understand it and retain it, and especially the information that I'm learning from the course, why do I need to go back and double up on reading it in the book to waste my time? Because a brother ain't got time for that. So the other thing I did was I read to get a better understanding of something. So let's say, for instance, if I'm dealing with a good subject like me, I'm black, I'm African American, I have a good sense of understanding for sickle cell anemia. I'm not saying every black person do, but if you're black and you're in the healthcare field, that's probably something you really care about, because they ain't treating people too well. They got sickle cell anemia, you know what I'm saying? So that's something that we got to know more about, because people are getting mistreated, misdiagnosed, and all this stuff for even having it. And on top of that, if you black, you less likely to get proper treatment in the healthcare field anyway. So that's why it's super important.
You think I'm playing?
But I use sickle cell anemia because I have a good understanding of it, but it was something that I kept seeing. So I read about it, read up on it, expected findings, complications, in terms of stuff like that, main symptoms, how to treat those symptoms, what's the priority thing to hydration, management of the pain, things like that, right? Preventing a sickle cell crisis. And the third and final thing with reading the ATI book would be to frequently things I frequently kept seeing. So meaning like if I kept seeing it while doing my practice questions, if I kept seeing it when I was doing practice A and practice B of the ATI assignments, then that means that I need to make sure I study and read up on it through the ATI book. And reason why it's important to do it through the ATI book, because whatever is said in whatever book that you use in your course, it may be slightly different from the ATI book. You're dealing with cleft palates, and it may say surgery done at 8 months or something like that, but ATI is like, nah, we do it from 6 to 18 months or something like that. It gives you the information that you need to know so that when you do take the ATI Proctored exam, you're answering it based off of the information that's provided from the ATI source. Does that make sense?
Of course, of course.
So that's the first thing in a nutshell, dealing with the ATI book in terms of studying. And the most important thing before we get into some examples is lots of practice questions. This is the best example I give. I'm someone who plays basketball. I love basketball, right? You want to get good at a jump shot, a 3-point shot. You got to be shooting in the gym. You got to be practicing. How do you expect to show up to the game making that jump shot that you need to make? Making the clutch jump shot that you need to make sure your team win the game when you ain't in the gym practicing and shooting that same jump shot? Don't make no sense. So what you gotta do is you gotta make sure you in the gym practicing. Practice questions, and I did a lot of them. In fact, when I show y'all the ATI stuff, I did all of them. I think on mine it's about like 398. I did all of them. Practice A and practice B, I did 3 times each. And on top of that, here's what people really didn't do. I probably don't really need to know. I'm gonna switch the whole game up with this one. You know Quizlet? Type in Google ATI Nursing Care of Children Quizlet. You're going to see a whole bunch of different practice-like questions and information that may be on there that's not on the adaptive learning quizzes, questions that's on your ATI. That's important because what it is, it adds that extra layer, it adds that extra buffer for you to learn more information, to give you more attempts and stuff for the practice. You know, you got to practice that jump shot. You got to practice those questions, right? Oh! So let's go ahead and get into it. Shouts out to OBS real quick. So let's go ahead and show y'all something really quickly. All right, so let's switch the screen. So one thing I want to dive into right here with this first one is that I want y'all to show that this ain't a fluke. If y'all watch my other video, I was the only level 3 in my pediatrics class, and I'm gonna tell y'all why. And this is what I did. I practiced questions relentlessly. So as you can see right here, I made an 85. Reason why this is important, because we go to the actual leveling rubric and understanding and breakdown of this stuff. You see, in order to get a level 3, you gotta get over a 78, right? And for our class and how we break it down in terms of the leveling stuff, you get a level 3, that's a 100 with remediation. You get a level 2, that's a 90. Level 1, 82. Anything below level 1 is a 75 flat out, no matter how bad you do. So that's a good thing for some people who don't really care to do any exams, right? So that's why it's super important. So I made it 85, so I got a little bit over the hump. And so that's that. That increased my probability of passing the NCLEX to an 88, which is dope. And that's dope to look at. So anyways, let's get into the main nitty gritty. So what I did to help me prepare. For starters, let's just go to this one first, because the other one is way more important. I did both practice A and practice B 3 times each. 3 times each. The first one is one I'm like, I ain't read too much. The second one, I did a lot more reading. The third one, let's actually confirm if the stuff that I did actually stuck to my brain and I actually retained it, right? The major thing though, you see this learning system RN 3.0, click on that. Click on that, it's super important. And so what you wanna do when you click on that is you wanna go to adaptive quizzes. right? Go to adaptive quizzes, right? Watch. I'm not gonna show y'all too much because I don't know what ATI go do. I ain't trying to get. Oh shoot.
A few moments later.
So I had a little technical difficulties. I don't know exactly where I left off at. So one thing I'm just gonna do is, I don't know, ATI was tripping. So I'm gonna still explain this the best way I can so you can still understand how I got the level 3. So just in case if I didn't already do this, so as I stated beforehand, you're gonna do practice A and practice B of nursing care. Now the teacher is gonna say, hey, it doesn't matter when you do it. Maybe your teacher has like week 3 we're gonna do practice A, week 5 we're gonna do practice B. You know, at the end of the day, you're gonna do bad on the first ones. Don't let that discourage you or anything like that. Just try to look at it in terms of assessing where your baseline of information of what nursing care of children is, aka pediatrics. Like it's to establish a baseline. From there, you can start building upon it like Lego pieces to help you get to where you need to get to if you're aiming for a specific grade. So maybe you're not aiming for a level 3, maybe you're aiming for a level 2. Whatever that you're aiming for, try to go past it. So if you miss it by a little bit, you still hit what you wanted to hit. Right? So you're gonna do both practice A and practice B, and then you're gonna go over to learning system RN 3.0. Now this is as of 2020. I don't know what this is gonna change to, so in the future, if anybody listening to this video, this is as of 2020, right? You're gonna go to quizzes, and then the next thing you're gonna do is, it's tripping on mine, is you're gonna hit adaptive quizzes. From there, it's going to send you into this hub to where you can select like questions that you want to select. When you click on adaptive quizzes and you go to the dashboard, one of the things I do is I click on the RN. I click on the Learning System 3.0 NCLEX RN, not PN, because I think PN is probably for like something else. I don't know. We're not PNs. We're going to be RNs. That's how I took it. So you're going to hit go on that. From there, you're going to see customizable exam. So how I did mine is I hyper focused, because if you're going to be nursing care of children, why would you select community health? Doesn't make sense. So you want to scroll down and select nursing care of children. Now, if you hit all questions, you'll see that it should be approximately 398 questions. Do all of them. Tackle it how you want to. If you want to do them 50 questions at a time, you want to do 100 questions at a time, whatever your pacing is at, do it. So that's what I did. And I switched my exam mode over to study mode. And the reason why I switched it over to study mode while you're doing these questions is because you want to be able to get an explanation behind why you got the answer right and why you got the answer wrong. Because it's going to explain each of it. It's going to explain why question A is, answer A is right, why answer B, C, and D are wrong. And it's important to know, because even if you guessed on something, whether it was an educated guess or not, you still want to have a basic fundamental understanding for the answers or the questions that you're seeing. And the concept behind doing a lot of questions is, it's almost like with the jump shot. You miss all the jump shots you don't take. You miss every shot you don't take. So with this one, how I relate to it is that you eventually are going to take enough questions or do enough questions to where you're going to see repeat of things. You're going to see something that seems familiar, because with this particular field of population of people, with this particular material that we're studying, there's only so much that can be covered. So you're good. It's not like you're doing adult health where there's like over thousands of questions to answer and stuff like that. No, we're doing pediatrics. So that pretty much concludes it. The last thing I'm gonna leave you guys off with is actually showing you guys what I studied to kind of help compile the information. Now, this is what I did. So I have a Word document where I put a whole bunch of things, including chapters from the ATI book of things that I studied and like literally was focused on. I know it doesn't show right here because my webcam is in the way, but there's 26 pages of information within this document. Now, if a person wants this, if you want this, again, you talking to a person that got the level 3, hit me up in my email, leave some in the comment section, and I got y'all. I'm gonna hook y'all up. Because again, you can do this. I literally studied for like a week straight. Not 2 weeks, 3 weeks or stuff like that. I studied for like a week straight. That was it. I didn't read every single page in the ATI book, but I made sure I did a hell of a lot of practice questions. So that's it for the video, man. If you found this video to be helpful, again, it's gonna be a little bit choppy in some of the places because I had some technical difficulties, but other than that, make sure you like, comment, subscribe, do all the good stuff, hit the bell to be notified. And if you want to know more information, you want to know how to become a good nurse, I'm not a nurse yet, but I'm speaking like it, then let's chat, let's talk. It's your boy Jamal _hockey. Peace out.
Tell them if they looking for me, they know where to find me. Put the pressure on them, watch them fall like origami. Ran up with